Hi, I'm Dr. Behnam. I'm a board-certified dermatologist and I practice in Los Angeles, California. And
I'm Dr. Behnam. Here I practice hair restoration and I specialize in FUE hair transplant, and we work together.
yeah, we work in the same office. Welcome to another stem cell hair restoration video. And so today I'm going to actually show another example of one of our patients who had thinning at the corners. His thinning is actually a mild case, but we still love to show it. So this is a gentleman who came in December of 2022, and he was thinning quite a bit right here. He was very concerned about it. He had used topical minoxidil for like a long time. It wasn't working. He's in late 20s, so he wanted to have basically just one procedure because he doesn't live in LA, so he had to basically come here for us to do the procedure. So typically with PRP you have to do it multiple times, but with stem cell and PRP you typically do it once. It's just a lot more powerful. So we decided to do a stem cell PRP session on him. You have to realize what makes him a good candidate for a stem cell and then for transplant is that he still has a lot of hair here. So he still has a lot of miniaturized hair, and what the stem cell does, it reboots those hair. It takes those miniaturized hairs and thickens them up, and as a result it gives a fuller appearance here.
Exactly. So sometimes corners, it may be thinned out and people desire hair transplant, but they may not be a candidate because of age, because maybe the hairline may be too low. It sets a permanent hair, so it sets a very low hairline. And this gentleman has already a lot of hair, but it just thinned out. So he's an ideal candidate to do actually stem cell hair restoration.
So we did a stem cell on him, and every time we do it, we definitely numb the patient up. And we do a lot of injections, and it's really about the technique of doing the stem cell injection. That's really what makes a difference. So this is him now in April of 2023. This is about like 4 or 5 months later, and you can see that a lot of these hairs grew out right there. And honestly, I think he looks better. And here's the other side. Here's him before, and here.
And that's after.
After procedure. Now, would he have been done well with transplant?
Well, in this case, every case is really different, but he chose to do stem cell and has done actually very well. And it's going to push the transplant, away for multiple years, and that would be great. The question that people ask about stem cell is that where does the stem cell really come from, right? So what is the umbilical cord? Could you explain?
It comes basically from the placenta. So females give birth and they donate that placenta, and companies take it and extract the stem cells and test them and then ship it out to doctors.
So these are healthy moms, healthy babies, never abortion. Even if the mom has a tattoo, they don't accept it.
Yes.
Is basically processed by the stem cell company and is sent to us, and it comes with the actual laboratory results.
Yes, it comes with laboratory results. We store it in a really cold freezer, and then when the patient is ready, we take it out, thaw it, mix it with your own blood, and then inject it. And we usually see the patients back in about 4 or 5 months later. And we always say that, look, stem cells is not a cure for hair loss, it's for temporary improvement of your hair growth. Typically results last about a year to a year and a half, depending upon the patient, and results do vary. So, but he did very well in this case for the widow's peak.
But I have to say, if there was something that you could just come and do for 2 hours and it would last for a good 1 year to a year and a half, that's great. Compared to the things they have to take every day and apply every day.
Thank you so much. Hopefully it helped. Bye-bye.